probably never heard of this before. Vectors are bugs or organisms that can carry viruses and other infectious agents. The common one that we're speaking about in this setting is, guess it, the mosquito. Mosquito-borne viruses are vector-borne viruses, and they account for many illnesses, including dengue, which is currently also apparent in our setting. We're in the tropics, and dengue is not a new viral infection. What is new, however, is that some strains of dengue can cause some very serious illness. For instance, you can have dengue hemorrhagic, where you might bleed from your gums or other parts of your body, because the parts of your blood that allows it to be sticky and to clump together are attacked by the virus. If you have an underlying condition, you're at risk of any viral infection, including dengue. Let's use an analogy. If you are going onto a treadmill and you're a reasonably fit person, even if the treadmill kind of increases in speed, you can keep up with it for a while. If you are not very fit, or you're like me, you haven't been to the gym in about 2 months, when you step back on the treadmill, even though the treadmill isn't going as quickly, such as with a viral infection, you can get very ill and you might fall off. So it's important that people who have vulnerable conditions, high blood pressure, diabetes, the one we often forget, but obesity, as well as people living with cancers, they are at risk of developing complications from dengue. They're not the type of people who should just stay at home, for instance, and kind of wait it out. You should seek medical attention early. And in addition, you should monitor those chronic non-communicable diseases, as I mentioned, such as checking your blood sugar as well as checking your blood pressure at home. It's also a good idea to consult with your medical provider to see if any of your medications might need adjustments, such as adjusting insulin because you're not eating as much because you have a viral infection. Drinking more fluid may have implications for people who have conditions like heart failure. So these are things that have been negotiated. Don't think that you should just be at home trying to get past the illness. You may need special attention. So in the midst of a viral season, what usually happens is that when you get sick, we don't want to go to the doctor. The first place you go is to your friendly or maybe not so friendly neighborhood pharmacist, and you just take something over the counter because you're trying to feel better. Many of these medications contain anti-inflammatory drugs, or NSAIDs. The NSAIDs are great at reducing temperature as well as reducing pain because they target inflammation. They are not good in viral infections, especially if you're not sure which viral infection. Remember, we spoke about the stickiness of the components of blood called platelets that are attacked in dengue. NSAIDs also make those components of blood less sticky as well. And as a result, you're already prone to bleeding. You could be prone to bleeding even more if you're taking them. So things over the counter like Advil or even Cataflam and Voltaren for chronic pain syndromes are things to stay away from in any viral infection. What's safe? Paracetamol, Panadols, or acetaminophen, as the pharmacologic name is. You can take that without worrying with interaction in terms of affecting your blood or even causing some very rare reactions that you can get in kids with viral infections. The secret, however, is that Panadols need to be taken on an empty stomach. They are a unique class of drugs that are not taken with food. And the common reason why people say they don't work is because they have them after a meal. So for adult patients without underlying liver conditions, the usual dose is 2 Panadols or 2 paracetamol or 2 acetaminophen on an empty stomach, or at least 2 hours after you've had a meal. Food contents cannot be there because of the acidity of the stomach and the amount of time the drug will spend in the stomach. So the drug is taken on an empty stomach. Don't take it and then have a meal because your stomach was empty. You have to wait for at least 2 hours to allow absorption to occur in another part of the intestine, but it gets absorbed on an empty stomach. So another interesting thing about this year's dengue season, and it's not as peculiar, but I guess we haven't seen it as often in Barbados, is that dengue usually isn't presenting with gastrointestinal symptoms like vomiting and diarrhea. This virus, however, this year certainly is. So many patients, as part of the initial symptoms, before the joint pain, before the headaches, before the pain behind the eyes, may experience gastro. And they may think this is just maybe some food poisoning, or they just have an upset stomach from something else. It's time to think dengue. And also remember that when you're treating that gastroenteritis, the drugs that you're using, stay away from the NSAID type drugs just in case this is dengue.